Kupata yangu mimba nikiwa mdogo ilini affect juu nilikuwa mwanafunzi. Ilinifanya nikaacha shule, sikuendelea na masomo yangu.
We experienced several cases of teenage pregnancies. That is between 14 to 19 years, coming in with the unplanned pregnancies, most of them being schoolgirls. These girls, most of them lack knowledge on how to plan not to get pregnant before their time reaches, so they find themselves coming in with the unplanned pregnancies.
Another thing that they lack is that they do not know that there are policies and laws that can protect them as they seek the sexual reproductive health services.
In Kilingile Health Center, I think we have an issue with the budgeting of reproductive health services, whereby yes, we offer the service, we have the commodities, but now you find the knowledge gap or the ignorance in the community.
Shida yenye tuko nayo kwa community ni wengine huenda hawana information ile ambayo ni mzuri. Kwa sababu kuna wengine wako na hiyo myth ya kusema maybe akichukua family planning atazaa mtoto ambaye ako na vichwa mbili, ama tena akichukua family planning itamfunga asipate mtoto.
I came to know about WE REACH through a meeting that we were brought together. We realized that they're also doing something to do on sexual reproductive health. And so at times we could have joint outreaches in the community. And so my role was mostly to mobilize for the people in the community and also facilitate health education in the community. Then going forward, WE REACH thought of bringing all sexual reproductive health organizations together to form a network.
WE REACH is a non-profit organization based in Kakamega County. We are working under 3 pillars. We have the WASH in primary school, the reproductive health and rights, entrepreneurship and business development. Under reproductive health and rights, we have 2 projects. This one for the budget advocacy, and we also have another one for the IPAS. That is where we are working with the community members on how we can demystify the norms, that is preventing them from accessing the sexual and reproductive services in the hospitals. Mostly we target the women who have been affected by gender-based violence. We want to economically empower them. We also target the young mothers and also the school dropouts, and we sensitize them on better ways on how they can protect themselves from unwanted pregnancies. So the title of our project is Reach Out with a Voice. So we are implementing it in Kakamega County, and we are working in the 12 sub-counties in Kakamega. We work with organizations that are implementing their projects in the 12 sub-counties.
The community voices is very important in pushing for this allocation of budget, because they are the basic consumers of these services. So they need to speak out and say what it is that they need to be taken care of.
We realized that the budget allocation for reproductive health and family planning has been gradually decreasing from the financial year 2017 to 2022. So from the financial year 2017, the budget allocation for reproductive health and family planning was at 10 million, but it reduced gradually from 10 million to 198,287.
As we were developing the county integrated development plan, you invite these interested parties and stakeholders in forums for them to actually come up with ideas on what projects perhaps the public would wish that the county government for the next 5 years that they do for them. That's where we actually found WE REACH, because after now getting these views, we retreat to actually prepare what we call a report on public participation.
Nilikuja kujuana na WE REACH last year, na wakati nilijuana nao walikuwa watu wa msaada sana, kwa sababu wakati tulijuana nao walikuja kwa ground, walianza na mambo ya safe abortion na wakasaidia sana watu, kwa sababu that time watu walikuwa wanafanya abortion ambayo ilikuwa unsafe. Alafu pia wakakuja pia wakawafunza kuhusu mambo ya family planning. Na from that time nimeona at least the community imebadilika. Most ya watu wanatumia family planning na wako positive saizi.
We received a grant of 2.4 1Million from KCDF that was to run for a period of 1 year, and the amount helped us to add more people to the network and also developing the memorandum and also submitting them to the county assembly. So the money has helped us to reach all those people.
KCDF being a community foundation, we focus on providing communities with not only capacity support, but also grants that enable them to live out their desired intentions around development. Also looking at how can we ensure sustainable development in Kenya.
As Giving for Change, the overall objective is to strengthen community organizations and to empower, to enhance the voice of the community members through civil society organization. In essence, the We Reach organization is advocating on behalf of the young people for resource allocation, for implementation of the health and reproductive health policies, which is a key document that facilitates the overall well-being of young people and the health budget for the county.
I'm advocating for the county to expound on the allocation of reproductive health so that it can cater for those services which can now bring in more youths and make sure these youths have enough knowledge to guide them on their reproductive.
By receiving a memorandum from the We Reach and among, of course, other organizations, we realized that they share the vision for the vision bearer for the county government of Kakamega, who is His Excellency the Governor. If you look at now the budget that was approved by the county assembly, which is now the current financial year budget, of course, overall, the Department of Health Services has gotten the lion's share based on the advocacies and the good messages that organizations like We Reach and others have actually had for the county government for Kakamega.
Our issues were taken into consideration, and the budget allocation for reproductive health, it has been increased from 190,000 to 1 million. So that has been our greatest achievement so far.
We expect to see the effects devolved to the dispensaries in the local villages, and we believe if people access these services, it will change a lot of behavior and unwanted pregnancies in the community.
Faida yenye nimepata kwa We Reach imeni expose katika hiyo hali ya kushughulika na watu na mobilize our young girls. Pia tumekuwa friendly kwa sababu mtu akiwa na shida ni rahisi kukuambia shida yake. Alafu pia We Reach wamefanya mpaka nimeongeza mafunzo.
Looking ahead, we will still work with the community members, and they will now own the project. And now they will also help in sensitizing other community members on where and how they can participate in the public participation, and also how they can seek these services in the hospitals. To our partners, the KCDF, we are happy for this opportunity, and we are happy to implement this project so that we can change their life and bring an impact to the society, and also reduce these high cases of teen pregnancies and unsafe abortions in Kakamega County.
We Reach.